The most widely used mouthwashes, containing strong antibacterial agents such as chlorhexidine, have become highly controversial in recent years. The oral cavity is not merely a passage for food, but one of the most complex microbial ecosystems in the human body, with over 700 identified bacterial species, some with undesirable effects, but others extremely important for overall health. The oral biofilm is not passive. It functions as an active biological structure capable of maintaining local chronic inflammation, influencing the mucosal immune response, communicating with other body axes, oral, intestinal, and oral systemic. Mechanical brushing or dental floss removes only the superficial layer of tartar and food debris. Functional mouthwashes act precisely on the biological components that remain active after brushing. First category, widely used during the pandemic due to antiviral effects, containing 1% hydrogen peroxide in seawater. 1. Perident H, hot. Perident H is formulated to control oral inflammation and local oxidative stress. Colloidal gold in biocompatible concentrations modulates microinflammation, reduces excessive activation of local immune cells, supports regeneration of the oral epithelium. Combined with hydrogen peroxide, low concentration, leads to controlled antiseptic effect. Seawater leads to mineral supply plus osmotic effect. Clove oil, warming plant, leads to analgesic and antimicrobial. The formula targets the chronic inflammatory phase without severely disrupting the oral microbiome. 2. Perident C, cold. Perident C directly targets mature bacterial biofilm. Colloidal silver is one of the few agents capable of disrupting the extracellular matrix of biofilm, EPS, effective against both gram-positive and gram-negative bacteria, does not induce microbial resistance. Oregano and menthol, cooling plants that combat acute inflammation, enhance antibacterial effects, reduce volatile microbial load associated with halitosis. Recommended for daily microbiological control, especially in cases of gingivitis or recurrent halitosis. Second category, propolis-based mouthwashes. 1. Prop Oral, barrier effect solution. Prop Oral is designed to support mucosal immunity and oral barrier integrity. Bioactive components with antiviral, antifungal, selective antibacterial, antioxidant, anti-inflammatory, and immunomodulatory effects. Propolis, boswellia, sage, aloe vera reduce the local inflammatory cascade, stabilize the oral mucosa, promote salivary IgA secretion, essential for local defense. Acts not only as an antiseptic, but also as an immunomodulator, useful in recurrent infections, chronic irritation, periods of immune stress. 2. Perident oral spray. Perident is a formula intended for long-term use and maintenance of oral homeostasis with botanical extracts and menthol. Extracts of green tea, aloe vera, boswellia, mastic gum, grapefruit, and chestnut provide natural antiseptic, antioxidant, anti-inflammatory, and vasoprotective effects, support gingival health, maintain a balanced oral microbiome. It is a biological maintenance product, not just a hygiene product. Mouthwashes should not be chosen based on flavor, but rather on biological mechanism, mucosal condition, type of oral imbalance. Follow us for content on the microbiome, inflammation, and truly functional formulas. Tell us in the comments if you'd like an episode dedicated to oral biofilm or the oral gut axis.